This morning I showed you that remarkably well done and deeply disturbing documentary film called The Social Dilemma, which is really the outline for this conference in many ways. Then after lunch break, we heard from four people. Dr. Sam Lightstone, let me tell you, he knows more about this than anybody. I can't tell you what he does now, it's so secret, but this man knows how social media works, and what he said, take it to the bank. And what he told us was not comforting, to say the least, but not impossible, not without hope. Professor Henry Abramson contextualized the breakthroughs in information technology through the ages, from Gutenberg to Facebook, if you will. Very interesting. And then the scariest of all, cybersecurity attorney Franklin Zemmel told us about what anybody who cares at all can find out about you. I can't wait to get home, and tomorrow we're going to see how well that works. But if you're not worried, you should be. And then our own Rabbi Dov Shochet gave us a lovely talk about, well, if all this is about invasions of privacy, what do we mean by privacy according to Torah and Chazal? It was a wonderful talk. It brought together many of the themes we've been discussing. So now we go deeper. Now we're going to talk about the impact of social media on each of us on three levels. The first level is the neurology. What does it do to our brains? The second is psychology. What does it do to us? What is addiction? What is trauma? And so forth. How do we treat it? And then we're going to hear about the spiritual dimension, for lack of a better term, dream work. And if social media are in some sense replacing, that might not be the right word, our dreams, something very profound is going on. So those are our three speakers, and I will begin by introducing our first speaker, who I'm just delighted to see, Rabbi Professor Dr. Avraham Steinberg. He is Associate Clinical Professor of Medical Ethics at the Hebrew University Hadassah Medical School. He is the author, and is affiliated with Shari Zedek Hospital now. He is the author of the Encyclopedia of Jewish Medical Ethics. Now, I know people who have edited encyclopedias. I never met anybody who wrote an encyclopedia before, but it is published both in Hebrew and in English, 3 and 4 volumes respectively. And the work earned him the 1990 Israel Prize. And I trust you know what the Israel Prize is. He's also the author of a 6-volume work, Harafua Kahalacha, Healing or Medicine and Halakha, that is so far only in Hebrew. He's director of the Medical Ethics Unit at Shari Zedek, and he's also chairman of the IRB. Now, you don't know what IRB means, but I do. And that's the Institutional Review Board. And that is the body of academics who oversee all the research that's going on. So the people on the IRB are the top people. And the chair of that, well, that speaks for itself. He's on the editorial board of the Talmudic Encyclopedia, and editor-in-chief of the Talmudic Micropedia. So we have a gentleman here who has a great deal to teach us. So I'm going to let him do that. And please meet Rabbi, Dr. Professor, I'm not sure I have this in the right order, Avraham Steinberg.
Okay, thank you so much for the eulogy.
Oh, excuse me, I forgot to say one thing.
Okay.
Forgive me. This is his latest book that he just gifted to me on the coronavirus pandemic, the historical, medical, and halakhic perspectives, co-authored by one of our local heroes, Dr. Ari Sements, who you may know, a pulmonologist at Mount Sinai, and he's our local expert. So I'm sorry, I had to throw that in, Rabbi.
Thank you.
It's all yours.
Thank you very much. And it's really a pleasure to be here in person rather than just to participate in this important convention by Zoom. I have been privileged to come already several times to this really outstanding conferences. I think this one is the 14th one, so we are beyond bar mitzvah and we're already adults, and yet there is so much to tell and to talk, and I'm greatly indebted to Rabbi Lipsker and to Professor Katz for organizing such wonderful conferences in the past and at the present, and hopefully it will continue in the future, and then hopefully we'll go back to see each other rather than to Zoom each other. So some of the definitions, we talk about the new media as opposed to the old media. What is the old media? That is what my generation used and probably is still using more than the other type, and that is the newspapers, magazines, books, even radio and TV are still considered the old media because they are non-interactive media. Whereas the new media is primarily an interactive type of formats, internet related, using digital technology such as websites, online video, audio. What we are doing now by Zoom is part of that, and it has its benefits, emailing and online education, which Chabad is very innovative and probably a pioneer in this type of the new media, and social media, which includes Facebook, Twitter, maybe Instagram, and maybe other devices that will come up or already are in progress. So what is our basic attitude towards such innovations? Okay, so there are some theological questions regarding such major innovations. One could ask, is it playing God? Are we really causing now such technologies, and they are, in my view, only the beginning. We'll see of it great improvements from a technological point of view. Are we getting to a situation that we are so-called playing God? And if not, at least intervening with nature, which such things have never existed before. So the answer to it is neither are right if done properly. The first thing, playing God, I put in parentheses, that's not a Jewish concept. It's taken from other places, because no human being can play God in any way. God is the only power in the world that can do something from nothing, yesh me'ayin. No human being can do yesh me'ayin. All we do is yesh mi-yesh. There is something existing, we're changing it in a dramatic way, but still from something in existence. So that all the innovations that we are talking about, including in the medical field, in technology, in agriculture, in other sciences, they are technical and not fundamental. They are not really creating something new, they are changing something from something. They are revealing something that is in existence, but they are not creating something that has not been ever in existence. In fact, the enhancement of the macro or microcosmos in many ways can even lead to greater belief in the Almighty than some sciences and scientists think the opposite. Some scientists think that by knowing so much, we actually know already everything, and we don't need a superpower that we don't understand. But the more we know, the more we invent, the more we see how there are more things that we don't know than we know, And yodea she'eino yodea, someone who knows that he doesn't know, is actually the highest degree of knowledge that one can aspire to. And therefore, the conclusion is that there is someone beyond manpower that is ruling the world. Now, the question of interference with nature has been a long-standing issue that we have been grappling with. And I think that the bottom line is that not only is it principally permissible, but perhaps even required to intervene with nature for the benefit of the human race. And I'll just bring a few examples to show from our sources this idea. One is the Torah says, and heal he should heal, v'rapo yerapeh, meaning that if someone injured another person, he has to pay 5 types of damages, one of which is to pay the doctor the fee for healing him. And as we know, fees for doctors are sometimes quite high. So the fact that we have to pay for healing, says the Gemara in Bava Kama, from here one derives a healer's permission to heal. If healing would have been a wrong thing to do, an interference with nature, HaKadosh Baruch Hu smites, and who are you, man, that heals? If this would have been the attitude, why does the Torah permit a physician to heal if it's a forbidden act? From here, says the Gemara, we see that intervening with nature, despite the fact that we believe that HaKadosh Baruch Hu wanted this person to be sick or wanted him to be injured, yet if I know how to heal him, I am obligated to heal him and to intervene with nature. Similarly, at the beginning of the creation of the world, Kadosh Baruch Hu says, all his work which God created to make. That's in Vayechu Hashamayim va'aretz, Asher bara Elokim la'asot. It doesn't say Asher bara Elokim va'asa. It doesn't say HaKadosh Baruch Hu created the world in 6 days and he completed the world. And from now on, we're not allowed to intervene. Rather, it says Asher bara Elokim la'asot, to be continued. I, HaKadosh Baruch Hu, created the fundamentals, the basis, the science of it, the possibility, but you continue the work and you intervene as much as needed for the betterment of the human race. And there are many other such sources. There are already some qualifications to intervene with nature. One is that the actual act must not involve any inherent halachic prohibition. For instance, there is an issue of kilayim. You're not allowed to breed together 2 different species in order to create a new species. That is exeros hakosuf. We don't understand why not. We're doing many more complex things than that, but yet it is a prohibition. And therefore, even if the outcome of a breeding of 2 species would be for the betterment of the human race, because something that will be created will be stronger and better, we're not allowed to do it because HaKadosh Baruch Hu doesn't allow to do it. So that has to be clear, that whatever we interfere with nature has to be cleared by halachic consideration. The other qualification is that the act must lead to no unavoidable or irreversible results, which is halachically prohibited. Maybe the act per se is at the moment halachically permissible, but if the outcome will become something that halachically is irreversibly forbidden, we're not allowed to start with it to get to a point where something will result in a halachically prohibited outcome. And obviously, the derived benefit should surpass the detriment outcome of this particular intervention with nature. But if we follow these 3 qualifications, we should be able, and perhaps even obligated, to do whatever is a progress for human nature. Now, we all know from an ethical point of view that science and technology per se are morally neutral. To have a Facebook or to have an internet or to have a heart transplant or to have a fertility treatment, per se, the science of it is neutral. It's not good, it's not bad. That is a fact. The determining factor from a socio-moral perspective is the use of that particular science and technology. If we are using it for the betterment, it is the right thing to do. If we are abusing it or using it to cause harm, then this particular technology or science becomes something unethical and we shouldn't use it. So these are the premises of what we are talking. Now, if we look at the new media, much of it is beneficial, both for individuals and society. It is not to say a priori that Chadash Asur min Torah, that's the phrase that Chassam Sofer used for anything that was developed new, because it may cause bad consequences. So in a paraphrasing way, Chadash Asur min Torah. It is true that it can lead to bad consequences, which we'll talk in a minute, but we should realize that it has also benefits. So it increases communication, social interactions, and community building across boundaries of time, place, and social contexts. Now that we are doing this by Zoom, we are reaching many people living in very far away places. If we would have it in the shul here where we sit, probably many people who are now listening to it would not be able to benefit from my colleagues' words, maybe something for myself too, but anyway, this is something that I think is a benefit. To stay up to date with family and friends around the world, I came from Israel, but in a touch of my phone, I can speak to my children, I can speak to my grandchildren, I can see them, I can communicate with them, which by the old media would be impossible. We can join or promote worthwhile causes. We can raise awareness on important issues. We can let many people know that there is such a conference by the new media so that they will know the existence of it and join it and hopefully learn something beneficial. We can allow people to express themselves through a wide variety of media. Not everyone has the qualification to communicate orally and to speak publicly or even individually, but they have a need to be in touch with others, and by the new media, it becomes possible. It can allow people to express themselves, it can increase the self-confidence by introverts who are in public or in groups have difficulty to communicate, but by writing alone at home and yet being connected, it has a benefit. And there are many other of such positive impact. Sophisticated databases can supply enormous information in a very short time without getting out of chair. And I must confess myself, as the chair, Professor Katz, mentioned that I wrote myself a whole encyclopedia. Most of the time I was sitting on my chair, and all the thousands of references were just by a click. I got the information and I could use it without running to libraries and running to schools and to other places in order to collect the information. So today, really, we can get a lot of information and good information through the new media. We can learn it's easier through media with all kinds of presentations. Like now we are presenting and you can see it. Hearing and seeing it is a better way of teaching than just hearing and not seeing in front of your eyes what is said. And certainly I'm not so sophisticated with this material, but if you have videos and if you have pictures and if you have all kinds of new gadgets, it can really enhance the way that people can learn and especially remember better if they have it. And again, many of such types that one can enumerate. But on the other hand, the new media has significant negative impact on individuals, on societies, and perhaps on the entire world. There's a lot of fake news running in the new media and misinformation on various degrees of danger. Some can convince people to commit suicide. Some media can convince people to believe in things that they shouldn't believe in. And with the new media and all the gadgets and all the new ways to present it, it can convince people to the wrong direction. It can lead people towards poverty, crime, nudity, violence, bad mental and physical health disorders, which we'll hear shortly, and other such severe misbehavior and outcomes. It has an effect on many aspects of human life, including the way we are thinking, the way we are voting in elections, the way we are interrelating to other people, hatreds, and all kinds of bad relationships, changing values, having the wrong values strengthened and good values disapproved. All this runs through the media to the new media in a way that sometimes we are not even aware that this is what it causes us to think about it. I, as a physician, encounter many times people who come to me with sheets that they downloaded from the Google, and as if they know exactly what they have, and all they want me just prescribe this particular medication that I'm sure is the right thing because I saw it on the internet, and if it's in the internet, that's it. And many times the diagnosis is wrong, the prescription is not the appropriate one, and it's very hard to convince them. They saw it on the internet. Who are you to tell me different?
Dr. Internet.
Dr. Internet. He's already a professor. You're just a doctor. So that is really a reality of life. And to tell you the truth, sometimes they find something in the internet that I wasn't aware of, and they may be right. And that's the good part of it, if you are willing to admit. Not all physicians want to admit. But in most cases, it really causes a lot of false alarm and disturbances and depression. And I think the downside of it is much worse than the good side of it. And again, we can go on and find negative aspects. To me, the most negative part is the waste of time. People are just looking, browsing, and looking for all kinds of things that they don't need. They're just wasting their time by doing it. And as we'll discuss later, it can cause addiction to the situation, which is a major problem. And it has a negative neurological consequence, which is the topic that I'm going to discuss briefly. So from a neurological point of view, a pure medical neurological point of view, the new media affects different brain functions in a very unique way. We are learning it. It's not yet fully established, but we have already many research points to show that it really affects the brain function in a physical way, in a detrimental way. It contains many combinations of stimuli that can trigger different reactions, and because of this, social media's effects on the brain appear in a variety of ways. For instance, the internet can produce both acute and sustained alterations in specific areas of cognition, which may reflect changes in the brain affecting our attention capacity, our memory processing, and our social interactions. And these are very important parts of what the brain is doing for us. And if it is doing it in a wrong way, it really skews away what we are as persons. Excessive screen time appears to impair brain structure and function. Much of the damage occurs in the brain's frontal lobe, which undergoes massive changes from puberty until the mid-20s. And this is a critical period of time of developing of the frontal lobes of the brain. And if in this time of life, people are using wrongly the new media, especially the internet, then the whole development of the frontal lobe of the brain will be damaged, sometimes irreversibly. So the psychological aspects will be explored by Dr. Goldwasser soon, but I'm talking just from the pure neurological point of view. And just to understand in a very simplistic way, the social media users receive positive feedbacks, the likes that we give them, and their brains fire off dopamine receptors, which is facilitated in part by the ventral tegmental area. So this is the area of the brain where a dopaminergic process is going on, which fires especially to the frontal lobe. It is located, as you can see here, at the bottom of the ventricles of the brain, around the midbrain, next to the pons and the medulla of the brainstem, and this causes, it moved, no, back, okay, and it moves towards primarily the frontal lobe. Now, this stimulation can affect cognition, motivation, emotions, and can cause psychiatric disorders and certainly psychological disturbances. Research shows that when browsing Instagram and viewing photos with many likes, it is associated with greater activity in this particular area of the brain in a rewarding processing, affecting the social cognition, imitation, and attention. It is very similar in this process to gambling and addiction to narcotic drugs, which work from the same areas. So it also affects the decision-making process of the brain and the emotional processing. Part of the brain of adolescents that deal with emotional and sensory processing react noticeably when participants feel excluded. So far we spoke about those who get likes, but those who are socially excluded by the social media can get to a very significant emotional disturbance, even to the degree of self-damaging, and it comes from these particular areas of the brain. Studies have shown even a time schedule of how long you sit close to the screen, and the longer you do it, the greater the damage to these particular areas of the brain is. And it's called even the Google effect, is changing the way we think. So the more we use Google, the less likely we are to retain what we see. The memory process becomes shuttered, short, and forgetful. Our brains use information stored in the long-term memory to facilitate critical thinking, and if we disturb this process, we are disturbing long-term memory. It also has significant impact on the attention span of people, causing or enhancing the situation that it's called attention deficit disturbances. Probably it doesn't cause ADHD to people who are not prone to ADHD, but it clearly worsens ADHD, and that is clearly shown that people that have an inclination or have a mild ADHD, the longer they use this new media, their ADHD becomes worsened. And also the whole thinking process today, because of the new media, is very short spanned by attention. You write a very short note in the in the WhatsApp, if you write a little longer, it doesn't even let you go on. You have to be very brief. You have to be even briefer with the Twitter. I don't use this technology, but I know from people and patients, you have to be very brief, and complicated things cannot be expressed in such a way. So I think that the neurological aspect is really disturbing. So in summary, potential harmful effect of extensive screening time and technology use include heightened attention deficit symptoms, reward processing, impaired thinking, impaired decision-making, impaired emotional and social intelligence, impaired memory, technology addiction, social isolation, impaired brain development, and disrupted sleep. So this list is frightening by itself, even just to mention it, certainly to be affected by it. With fewer than 30 years since the internet became publicly available, the long-term effect have yet to be established. We know it, what I enumerated now, but it is only 30 years, and such processes take longer to establish the final end result. So the principles are as follows. Experience shows that such major developments cannot be stopped. Even if we enumerated how bad it is, although I mentioned what good it can do, and we shouldn't neglect this part, but assuming that it is bad, it won't help to efface it. It won't disappear. So we have to live with it. So it can be used and abused, and it is therefore what and how we use the new developments rather than do we or do we not use it. There are parts in society that excluded the whole new media. They don't allow smartphones, they don't allow any use of the new media technology. I'm not sure that this can hold for a long time. I'm not sure that people under the table who are not allowed to do it above the table are not using it, and then they may use it even worse than they would if they would be allowed with limits. So therefore, it should be used but controlled in order to increase the positive effects over the negative ones. And as Rabbi Meir did with his Rabbi Elisha ben Avuya, Tocho achal klipato zarak, he ate the inside and threw the shell. We should do the same with the new media. We should use the good part of it, but we should throw away and be aware of the negative parts. So one way to avoid the negative impact is to avoid the new media altogether. This, as I said, will deprive us from the positive aspects and probably on the long run will not be possible. We should be mindful of our social media habits. We should limit the amount of time spent on social media. We should know when it is time to stop and use it only in order to do good things with it, get data that we are needing, get inspired, get friendly with people, but not abuse it so that there will be brain damage and social damage that will not be able to improve. Thank you.
Our next speaker is Dr. Norman Goldwasser, and here he is. And he's a licensed psychologist based in Miami Beach and in Boca Raton, originally from Newport News, Virginia. He went to high school and yeshiva in Talmudical Academy and Ner Israel in Baltimore, and then on degrees in psychology and health science from Johns Hopkins. He did his graduate training at the Medical College of Virginia and got his PhD in clinical psychology and simultaneously, I think, a master's degree in industrial and organizational psychology. His areas of expertise in clinical practice include some of the things you just heard Rabbi Steinberg talking about, trauma, addictions, depression, attention deficit disorder in adults, and so on. And let me also tell you that Dr. Goldwasser is, without doubt, one of the most respected psychologists in our area. And He is a regular, more or less, at our conferences, and I'm very, very happy to bring him to you again this evening to talk about now the psychological impacts of social media. Norman Goldwasser.
Thank you, Nathan, and thank you, Rabbi Litzker, for inviting me back again. Okay. So, since Dr. Steinberg did such an excellent job of discussing the positive aspects of the social media, I'm going to skip that over because can't improve on perfection. So I'm going to go straight into the challenges associated with social media. So first of all, the involvement in social media has profound effects on our self-esteem, self-concept, especially with older children, adolescents. Feeling of inadequacy is pervasive when you know that you're trying to compare yourself to these perfectionistic and often distorted images that are purposely enhanced. And when you have a developing adolescent comparing themselves to their perfection, and you compare it to the idealized lives of other people who are just throwing out how amazing their lives are without really talking about what's going on, obviously you feel inadequate, insecure, poor self-image. One of the things that often occurs with especially adolescent girls is something called body dysmorphic disorder. This is a subset of obsessive compulsive disorder, which we'll discuss later. But body dysmorphic disorder is basically a gross distortion of perception of one's body, and especially specific body parts. And when you're watching these idealized, perfect images of your peers, and you have the predisposition towards OCD or BDD, it's liable to bring it out, and they get stuck on their body imperfections. FOMO, fear of missing out, focus on what you're missing out of, can trigger anxiety and cause checking, which leads to the discussion of obsessive compulsive disorder, OCD. Teenagers average 7.4 hours per day on screens. 7.4 hours. Now think about it. 24 hours a day, right? Dr. Katz? They're sleeping 7 hours, so that brings it down to about 17 hours. They're in school for about 8 hours.
That's every other.
So 7.4 out of the 9 hours, they're on their screens. That's average. There's some teenagers that are more. 1 in 4 checks their social media at least 2 times an hour. This leads to compulsive checking. Sometimes it's compulsive, where it's just constant. Obsessive preoccupation. They can't get the thoughts out of their head. They're constantly thinking about their likes and about how they compare to their friends' Instagrams and how many likes that their friend had versus their likes. OCD often involves comparing and contrasting and competing, and this just spikes that up manyfold. Over 100% increase in OCD and related anxiety since Instagram began in 2010, and Snapchat in 2011. Rates of depression in teens increased by 80%, and in preteens increased almost 120%. Now, is this causative or correlative? We don't know, but we certainly know that there is a relationship between the incidence rates of depression and anxiety and OCD has skyrocketed since social media has erupted 11 years ago. What's even more disturbing is suicide rates amongst teens are increased by 150%, and in preteens, 60% during the same period of time. Coincidentally, yesterday I got an emergency call from a patient of mine that's in New England, and they said that we need to speak to me if they can try to cancel someone, which of course I did. And they found out from their school counselor yesterday morning that their 12-year-old daughter had revealed to her that she had thoughts of ending her life. And of course, school got into action, and the parents, they got into an emergency appointment with a psychiatrist who wanted to hospitalize her. They were scared by that. They went into an ER room where the psychiatrist had said that she is depressed, seriously depressed, and that she needs to be seen and medicated. And through both of those evaluations, they didn't really focus on any etiology, what's going on, why. Straight A student, socially very accepted, highly functional, stable family. What's going on? Why does a 12-year-old want to kill herself? So I asked them, are you checking her social media involvement? So, well, that is a bit of a problem. What kind of problem? Well, she's on it constantly. So I said, did you think that there may be a connection between what she is seeing and what she's experiencing? There is some OCD in the family, that maybe this has hijacked her and that she is out of control. And they sat down with the daughter, and she revealed to that she is obsessively preoccupied with all of her imperfections compared to her peers, and that she's not nearly as pretty, she's not nearly as popular, and she feels there's no hope. 12 years old, to the point where she had ordered online a whole supply of pencil sharpeners, and she was planning on taking the razor blades out. Normal child, normal family, a academically superior child. Why? We talked about perceived inadequacy due to unfavorable comparisons. Teens can never measure up to perfected Photoshop versions of their peers. Electronic interactions, the interactions via text, are always less satisfying and more alienating than person-to-person interactions. Why? Because there's no chemistry, there's no connection. It's very hard to connect online. One of the reasons why the people in our profession has struggled over the pandemic is because we've been operating remotely. And the qualitative experience of psychotherapy remotely is very different than when you're face-to-face. The connection is far greater. PSI, that is not the tire inflated index. It's perceived social isolation, which is strongly correlated with social media use. You would think that it would be less isolated, but their PSI indices go down with the amount of social media. Talked about FOMO. Kids get preoccupied with missing out on uninvited events. The feeling of being left out. It's not just being left out, it's about rejection, it's about exclusion. And when you have a very vulnerable adolescent who does not have the coping skills to be able to process that experience, it's very damaging to their self-esteem. Cyberbullying most often occurs in social media, Facebook, Instagram, Snapchat, TikTok. It's about sending harmful, damaging posts, sharing embarrassing content about someone else. It could be totally false. It could be malicious, malevolent, and very often it can be done without any repercussions. And the individual cannot defend themselves. There's nothing they can do. So the sense of powerlessness, the sense of victimhood and victimization is very powerful, especially with adolescents, where social acceptance is vital. It's far more damaging than conventional bullying because of the extraordinary scope of the shaming. If the kids get bullied on the playground, okay, they get humiliated in front of their kids. But if you're bullied on a platform where there are tens of thousands of people that are observing, and something that is said or damaging photos are shared online, that public humiliation is far more great. Now, there are laws and sanctions regarding cyberbullying, believe it or not. All states have laws protecting individuals from cyberbullying. And schools are legally required to respond to claims of cyberbullying. And most states require schools and districts to develop bullying policies and procedures to investigate claims. Many states require bullying training for all teachers. I've actually presented in a number of conferences about bullying and the effects of bullying and what teachers can do to be able to sensitize children in terms of bullying. Most states consider bullying and cyberbullying a criminal offense. In Florida, statute 1006.147 specifically addresses cyberbullying. It defines it as bullying through the use of technology or any electronic communication. Without harm, it's just a misdemeanor. But if there's an explicit threat, and that can be an emotional threat, psychological threat, a social threat, it can carry a sentence of up to 5 years in prison. It's serious, and we have to take it seriously.
So we know that addiction, that social media addiction, fulfills all the criteria of an addiction. How so? Well, social media, when you're involved in a social media, you can't control the impulse. It's very difficult to be able to do that. What's really important is that the behavior persists even after it becomes aversive. At some point, kids and people and adults know that it's aversive, but they can't help themselves. And they know that their grades are suffering. They know that it's affecting the relationships, but they can't stop. What's even sadder, and this is probably the most significant problem that I see when I'm working with families and kids who are, I would say for sure this is the number one problem with families that I work with kids that are so addicted to social media or games. You see kids that normally have very robust lives, that they're out, they a year or two ago they were out playing with friends, they were in sports, they were enjoying themselves, they were in the pool, and now this is all they're doing. Every minute they have, and obviously when the parents try to get involved, it becomes a problem, which we'll talk about later. Withdrawal. What's really difficult about this is that when a child, especially from an Orthodox family, they're expected to be off their phones on Shabbos. Some of them do, and it's very distressing. What is more distressing is the number of adolescents, pre-adolescents in the Orthodox community that are on their devices on Shabbos. They're still religious. They're not off the derech. They're not defying. They're addicted. They can't stop doing it. They can't handle the withdrawal, the anxiety, the FOMO. They can't get beyond it. So they can't resist the temptation or the compulsion, which is more likely, more accurate, to check. So their own phones on Shabbos. Quite often, this is what brings the child into therapy. The parents are shocked that their religious child is on their phone on Shabbos, and they incorrectly assume that they're off the derech, that they're no longer observant, and that's not the case. It's because they can't control themselves. So let's talk about trauma and the role of trauma. So what we know about trauma victims is that their nervous systems are much more activated and triggerable than the average person. Quite often when people experience trauma, the limbic system, the emotional part of the brain, is highly charged. And the traumatic memories in the hippocampal area, the hippocampus area, which is the memory center, where our memories are stored, because of the trauma preventing the processing of these traumatic memories, they're stuck in the nervous system, alive and very distressing. So trauma victims look for ways to soothe their nervous system. And that's why there is such a disproportionate number of trauma victims that have addictions. Social media is like all the other addictions. It's an escape. It allows people to be able to anesthetize themselves emotionally and to be able to focus away from their traumatic memories. We know that there's a neurocognitive reality that you can't think two thoughts simultaneously. So if you're involved with Instagram or Snapchat or just getting caught up with all of the drama of what's going on with your social media, you're not connecting to those traumatic memories. So trauma victims are highly vulnerable and very much at risk. And also because of the intensity of their emotions, they're much more likely to fall into compulsive behavior. Whatever they do intensely. They emote intensely, they also behave intensely. So they're much more likely not only to get addicted, but to get severely addicted, to be completely out of control. So obviously when you have children who've been through trauma, it compounds the problem because their brains are not developed to be able to cope with the stressors of life. And quite often people throw themselves into social media as a maladaptive coping mechanism. This is the way they deal with stress. Imagine if you have an underdeveloped brain, you're an older child, an adolescent, you're much more vulnerable to fall into these maladaptive behavioral patterns to deal with stress. And it's whether it's stress from family dysfunction, family trauma, the stress of homework and academic stressors and expectations, or the stress that they get from the social media. Kids are going to be much more likely to fall into this. And what's really amazing to me is that in our country, you can't drink until you're 21. You have to wear seatbelts. You can't smoke, I think, till 18. The government feels compelled, which rightfully so, to regulate at-risk behaviors. But a 12-year-old can go onto a social media site at any time and get highly addicted, and they haven't done anything. Recently, thank God, there have been whistleblowers, and there's much more transparency in terms of the very pernicious efforts on the part of the social media to promote addiction. They have people who are specifically trained to be able to increase the addictive quality of these social media platforms deliberately. They're hired to do that. And now that they're exposed, hopefully that there's going to be change. So the question is, what do we do about this? What are the recommendations? So in general, with all due respect, I know that the good doctor, Rabbi, professor, who I greatly admire, was talking about that you can't get rid of this. So with all due respect, I will humbly disagree. And I think this relates to a general machloket in the field of addiction, and that's the disagreement or the conflict between two models or two paradigms. One is controlled use versus total abstinence. And it's very controversial. You have people in the 12-step community that feels that it's either total abstinence or nothing. And then with more the psychological community, you look at coping skills and be able to have controlled use. We look in terms of alcoholism. There are some people who say, one drink and you're a drunk. There is no such thing as controlled use. And there are others, like rational recovery, that focus on developing skills to be able to drink moderately. So I think when it comes to adults, I think that there could be some room in terms of controlled use, but I think in terms of children and adolescents, their brains are just not equipped to be able to handle that. The dopamine spike that happens with these likes are so strong, it's likened to cocaine. And we're giving this to our kids. It's like giving them cocaine. So I feel strongly that parents, well, I'll get to parenting in a minute, but I think for adults that there is no need for social media. I'm not saying get off the internet, not use the computers. That's not reasonable. But in terms of social media, it's highly addictive, and it does take time away. And I think from a spiritual perspective, also, it's the values that come across in the social media are so antithetical to what we're trying to promote in our families and for our own spiritual growth. To knowingly expose. It was interesting. I was speaking with a caregiver of a patient of mine in Israel, and they were trying to communicate with a family that only uses a specific platform. I think it's called Telegram, which is just like WhatsApp. It's nothing. I said, you won't use Telegram to communicate? He said, no, I don't use any of this because you have to have a geder around this. And I prefer not to use any of those platforms. It doesn't make a difference. I don't think it's, I don't want to get started. I said, okay, I'm not going to touch that. But there's a lot of reason to advocate for getting off of all social media platforms. You know, when I grew up in the 60s and 70s, we didn't have cell phones, much less social media. And somehow we survived. We survived. We somehow, I don't know. You know, I think that that the positives, there are positives, but there are other ways to be able to achieve those positives without social media. And that I think the negatives and the potential for addiction and harm to oneself and to one's family far outweighs the positives. I'm not on any social media, and I love it. I feel it's sometimes connection can be a disconnection because you're disconnecting from the people around you. You're disconnecting from yourself. Getting back to recommendations, if you are going to use a device or you're going to be on social media, then I think you should have designated times and that you stick to it. You check in the morning, you check at night, and that's it, not during the day. You don't have a phone around during the mealtime. You don't have a phone during davening. At Minyan, when I see these people, they're just like this the entire time during Chazaras Hashatz. I don't understand. It's like so. And before you go to sleep, most people have the need to check, but the energy that's coming from the phone is actually an activator of the nervous system. So just when we're trying to go to sleep, we're activating our nervous system. It makes no sense, and we wonder why sleep disorders have increased dramatically. In terms of parenting, the first thing that and we're going to see a video clip in a minute, I tell parents, take charge, get empowered. Many parents have become disempowered. Part of it, it's a cohort effect. Kids these days are far less likely to respect authority, but also because it's very easy to be able to tell your kid to stay off drugs, to not drink, even not to gamble. But social media, it's normative. The kids will look at the parents as they're dinosaurs. What do you mean? No TikTok? What are you talking about? So, and parents, they buckle. So one of the things I tell parents is that kids, even though at a conscious level, they challenge you, they're oppositional, they can be defiant. At an unconscious level, they desperately need to know that someone is in charge, not them, that there's a captain of the ship. Parents need to be able to understand that children need to know how to accept limits. What I say to parents is the most loving word that you can say to a child in their life is no. You have to be able to love your child enough to be unpopular for a minute, an hour, a day, in order for them to understand that A, you're in charge, not them, and B, for them to be able to be conditioned to accept limits. Boundaries are critically important for children in their development. They have to be able to have the ability to have frustration tolerance, to tolerate frustration, to be able to accept no for an answer. And when parents, either because they want to be loving parents or they don't want to deprive their kids, what they're really depriving their children of is a vital life skill to be able to deal with limits. So one of the things that people ask me, obviously when I work with kids, quite often they're oppositional, defiant, they're whether they're off the derech, they're on the derech, very, very challenging. They're argumentative, they have no respect for authority, they don't follow rules, they can't follow rules. So with those kids, you have to be strategic. There has to be a balance between limit setting and strategy. So one of the things I tell parents with older kids is to use the Socratic method, to ask them questions about what they feel is going on, and to try to maneuver the conversation in a way that the kids come to their own conclusion that they need to do something about it, which is a skill in of itself, but it's a skill that you can learn. Parents can learn how to maneuver their kids to be able to come to their own conclusions, because if it's forced, then it'll just fuel the oppositional defiance. And the last thing I want to say about parenting is I'm a big believer in family meetings. I believe that family meetings are a critical part of a child's development. It's where they learn how to communicate, they learn how to express themselves, they learn how to hear, to be makabel what their parents say. And it's a way to be able to put things on the table so that parents can present policies, procedures, limits in a way that the kids feel they have a voice. It's not being just shoved down their throat. But the bottom line is parents have to be in charge. So with that, we have two video clips that I want to show you. One is and it comes from a wonderful video called "This Is Why You Don't Succeed" by Simon Sinek. And I want to show you the first one. This is the longer one, right? Which is an overview of the addiction process, and then we'll do a short one after that. So please.
I mean, the technology is great. You know, it's lots of fun, very helpful, makes a lot of things easy. But like anything in the world, there is too much of a good thing, you know? And I think one of the things we don't talk about is what is the balance of technology in our lives. And I would argue that for many of us, it's out of balance. We know that the chemical dopamine is released whenever we get a bing, buzz, flash, or beep from our phone or email, right? So dopamine is the exact same chemical that's released in alcohol, nicotine, and gambling, right? In other words, it can be addictive if left unbalanced. A little alcohol is great. Too much alcohol, not so great. Gambling is fun. Too much gambling, really bad, right? Technology is wonderful. Too much technology can be very destructive and destroy our relationships, like all addictions destroy our relationships, right? And so one of the things we're not considering is what is the right balance. If you wake up in the morning and you check your phone before you say good morning to your spouse, that's a problem, right? If you have phantom beeps, that's a problem. That comes from something, right? If you find yourself incapable of getting through a day without needing to check, that's a problem, right? Now, where it gets really dangerous is with kids, millennials. Some of them aren't kids anymore.
Right.
So almost all alcoholics on the planet discovered alcohol when they were children. When we're very, very young, the only thing we need is the approval of our parents, right? When we go through adolescence, we now need approval from our peers. Frustrating for our parents, very important for us because it allows us to acculturate outside of our immediate families into the larger group, right? Very stressful time, and we're supposed to learn in this time of anxiety to rely on our friends, to reach out to our friends for help. That's what we're supposed to learn. Some people, quite by accident, discover alcohol. And then they learn the numbing effects of dopamine actually help them get through the stress of adolescence. This connection, unfortunately, becomes hardwired. And so for the rest of their lives, when they face any kind of financial, career, or social stress, they don't turn to a person, they turn to the bottle, right? Now, we have age restrictions on alcohol, cigarettes, and gambling, because we know that an immature mind is not yet strong enough or mature enough to deal with the powers of these addicting chemicals, these addictive chemicals, right? So we put an age limit. We have no such age limit or age restriction on social media or cell phones, right? So ostensibly what we've done is we've thrown open the liquor cabinet and we've said to our adolescents, hey, I know this whole adolescent thing is really stressful, so here's the vodka, take as much as you need. That's basically what we've done. And so what we have is an entire generation that's growing up addicted. And like all addicts, they haven't learned the skill set of when they suffer stress to turn to a person. What they do is they turn to the device. And what that only does is increase senses of isolation and loneliness, and can actually destroy relationships. We've all had the experience where you're with somebody, walking down the street, in a meeting, out for dinner, whatever, and they pull out their phone, and you feel like an idiot, right? Or when you're talking to them and they're going, and you're sort of like, what's the point of this? Now take an entire generation that has no memory of a time before the device. We at least can reference times before cell phones and internet and social media. We at least have a point of reference. They don't. So this is their normal, that's how they feel. So you have an entire generation growing up with addiction and an increased sense of loneliness and isolation. We're already seeing the results. We're seeing increased rates of suicide amongst this generation. We're seeing increased rates of accidental deaths due to overdoses amongst this generation. We're seeing increased numbers of mass homicides, largely performed by this generation. School shootings, over 70% perpetrated by kids born after the year 1984. Schools, universities are now dealing with numbers they've never dealt with before of kids requesting leaves of absence due to depression. We're already seeing it, right? We're seeing the effects of loneliness and isolation. We're seeing it, and yet we're not reacting to it. We're not doing anything about it, right? And parents are a lot to blame for this. Because parents, there are some schools who want to restrict phones in the schools, and it's the parents who demand that they keep their phones in case of emergencies. Seriously? Seriously? When was the last time the cell phone was used for an emergency? What time are you coming home? What time should we pick you up? And if there is an emergency, you call the office, and they know what classroom the kid's in, and in 5 minutes, they'll bring the kid to talk to you on the phone. Like, the old way worked just fine. Remember, we talked before about innovation. It has to solve a real human problem. What human problem exactly did we solve by compressing the 5-minute time frame? We added to the problem, we didn't solve it. So that's one huge problem. So combine that with the fact, so you have an addicted generation that doesn't have the skill set to ask for help. Combined with the fact that they're so good at Facebook and Instagram, they're good at putting filters on everything. So they're good at showing you how smart and strong they are. These kids who commit suicide, you go look at their Instagrams, you would have no clue that they were depressed because they're happy and they're star athletes. Parents have to intervene. We have to stop giving our kids free access to social media and phones at young ages. They are not ready for it. Their minds cannot cope with the dopamine. Balance is fine. You can give a kid a phone, but they can't use it in their bedroom. They can't have it at the dinner table. They can't take it to school. They can only have it up to a certain hour, and you take it away. They're children. You can take the phone away. We've got to intervene.
Thank you very much, Norman. If only. Okay, now we know how it affects the brain. Now we know how it affects, what shall we call it, the mind? Psychologically, I mean. Now we're going to go in a slightly other direction on this and look at dreams. So Rabbi Pinchas Taylor here is a South Florida native. He graduated from Biblical College of America, and he initiated outreach projects in Alaska, California, Florida, Hawaii, and overseas in Russia and Greece. Not bad there, my friend. That sounds like good. He is now director of adult education and outreach at Chabad of Plantation. He's a certified cognitive behavioral therapy practitioner, a certified clinical trauma specialist, and a member of the American Council Association and Association for Conflict Resolution. And I'm just going to turn it right over to Rabbi Taylor. What are you going to tell us about, Rabbi?
All right, so we're going to talk about a little bit, at least, about the influence that social media, the internet, can have on someone's dreams. Now, we've heard sort of what goes on in the waking life, and what goes on in the waking life certainly has an influence on what takes place in the dream world. And so before we kind of paint the spiritual picture of the effects that the internet has on dreams, I want to kind of give a brief background on some of the sort of historical and psychological and then spiritual exploration of dreams as it's been seen throughout the centuries. So one of the most curious topics that's been pondered since time immemorial, since across all cultural lines, since the beginning of written history and before, is the nature, the purpose, and the interpretation of dreams. And it's no real surprise that people would be curious as to the nature of their dreams. That the average person spends 26 years of their life sleeping, and 6 years of that are spent dreaming. So if you just do the math, the average age and sleep about a third of the day, you're spending 26 years of your life sleeping and 6 years in the dream world. So it's no mystery that people be curious. What's the purpose of these things? Why do we do it? What's behind it? And so there was this is something that kind of made its way through the different camps in philosophy. In the East, there was an interesting writing by a Chinese philosopher called Zhuangzi dreamed he was a butterfly. And the book, the story was about this man Zhuangzi, this philosopher Zhuangzi, who had this recurring dream that he was a butterfly. And he kept dreaming about it so much that he began to wonder to himself, was he Zhuangzi that just finished dreaming he was a butterfly, or was he a butterfly that just began dreaming that he was Zhuangzi? And this sort of like interesting philosophical idea, thing that we ponder, made its way to the West as well. And the outcome of it was, in a philosophical terms, a person can only sort of believe that they're awake. There's no way to really tangibly prove, from a philosophical standpoint, that you are awake. And this idea was something that was, interestingly enough, brought out by René Descartes in Western philosophy. And he used dreams he brought out sort of a spiritual element. He said it's easier to prove that God exists than it is to prove that the world exists. You think, what do you mean? How is that possible? Well, the idea is that you ever had a really vivid dream where you really see the sights and hear the sounds and everything seems so real. So he said, how do you know that in your waking life that all of the things that you think you see and that you think you feel and you think you smell and that's not just a very, very vivid projection of that your consciousness is projecting, that you're experiencing, that you're not really experiencing it, that it's your consciousness that's sort of telling you that you're having all of these experiences. And so he says that you can't really prove it philosophically, but if you have a thing of consciousness, if you have consciousness that's processing this world, the consciousness itself had to come from somewhere. So it's easier to prove that God exists than the world exists. And so the exploration of dreams in philosophy became something more studied in the realm of psychology, beginning in 1900 with Sigmund Freud, who in his magnum opus, on the interpretation of dreams, he becomes like a modern day Joseph. And he actually identifies himself as such. He visualizes himself as such. And what he explains is that the dreams that we have, they all carry with them meaning. It all has everything in the dream, has symbolism behind it, has something that is being conveyed. And these ideas also were reflected in different ways by psychologists through the 20th century, with Carl Jung and Alfred Adler, also expressing that our dreams can be sort of a manifestation of some of our inner emotions. In other words, if there's something that in your waking life you maybe weren't able to express, the dream world might be an appropriate way that your emotions can express themselves. So, during your work day, if you really are upset with your boss, your emotions really want to scream at your boss, but you stop yourself, because if you scream at your boss, you might get fired, there might be undesirable consequences. But in your dream, your emotions might be able to sort of express themselves in a positive way, or not a positive way, but they may be able to sort of express themselves the way that they want to, without the repercussions. And so you might have a dream that expresses those types of emotions. One of the things that we know about dreams as well is that there's something that helps with the creative function. There's something that helps people. There are many famous examples of discoveries that were either made or solidified in the dream state. And they certainly, we all know instinctually almost that dreams and sleep are helpful in the creative process. In fact, if somebody has a big decision to make, one of the first things that you say is like, let's sleep on it, and then we'll see what comes about from that. Because you have to, you rest yourself, and perhaps something creative that wasn't available in your waking life will come to the fore. There's a very famous example of Albert Einstein. There's this story told that Albert Einstein, when he was trying to figure out the last, how to formulate exactly the theory of relativity, that he had a dream that he was a young boy on a sled and he was sliding down a snowy hill. And as he was getting faster and faster and faster, he saw that space, that the stars and whatnot were changing. And he recognized, it solidified in the idea that time and space and that there was a correlation between the two. There was there's a story of Elias Howe as well, who invented the electric sewing machine, that he thought of the idea for the needle that's used in the electric sewing machine after he had a dream. In the dream, he was being chased by cannibals, and the cannibals were carrying these sticks. And the sticks, the shape of the stick, he said, "Oh, I can use it." And that's what he used for the needle of the electric sewing machine. Then there are dreams that sort of foretell the future, that you have them, and what ends up happening is that event that you dreamt of winds up taking place. And one of the most famous examples of this was a recurring dream that President Abraham Lincoln had, that he was going to be assassinated. And in his dream, he comes down the stairs to the East Room in the White House, and he sees a casket that's surrounded by soldiers and mourners. And he goes over to them in his dream and says, what's going on? What happened over here? And so the person in his dream says to him, it's the president, he's been shot by an assassin. And this is a dream that took place many times prior to his actually being assassinated. In fact, his security guard, his bodyguard, was named William Crook, who later was participating in his biography, said that he remembers the night that Lincoln went to Ford's Theater, that because of these dreams, they were getting a little nervous. He warned him, maybe you shouldn't go to Ford's Theater, right? And he recalls distinctively that Abraham Lincoln wished him a different farewell than he did on normal nights. On normal nights, he said, "Good night, Mr. Crook." On that night, he said, "Goodbye, Mr. Crook." And he remembered clearly that there was this distinction made that night. And it's very, very interesting. So there are various explanations as to what our dreams across time are conveying. There's no solidified concrete conclusion as to what purpose dreams play in our world, but there's a lot of discussion. A lot of discussions are very interesting. So there was a study in the 20th century by a man named Calvin Hall, and he spent decades researching the dreams that people had, and he I believe cultivated 50,000 accounts of dreams from people across all culture lines, men and women, and old and young, and every sort of differentiation that you can make between people. And he logged their dreams and what they were dreaming about. And even something he found was very interesting is that people across all culture lines, across all age groups, tend to dream about the same type of things. In other words, that there are dreams that I will dream about and you dream. The people involved in them, in my dream and your dream, might be different. But the concept, the storyline of the dream, the theme of the dream is the same. And so they say that the most common dream that a person will have, that is found across all culture lines, is the dream of being chased. It's really a nightmare, but it's a very common dream. It's extremely common, and And what is the hypothesis as to what that is conveying is that all of these dreams are conveying a message, a subconscious message of what's being processed in your daily life. So if you're emotionally processing an experience in your waking life, that might create a certain storyline in your dream world. And so the guess, the idea as to what this dream of being chased is talking about is that in your waking life you feel like you're being chased down, like you're being hounded down. Maybe your boss is being overbearing on you. Maybe there's a certain person that you're trying to get away from, or you feel like you're trying to get away from. Another very common dream is the dream of falling. The dream of falling or drowning. That's very like negative dreams, very scary dreams, and that's a symbolic or a processing your brain has of feeling sort of overwhelmed in your waking life. So you may, if you're feeling overwhelmed in your waking life, you may have a dream about either falling or drowning. And there's the opposite dream, right? The flying dream, the best dream in the world, right? It's so much fun to have that dream. Get it like once every few years. And that's sort of like in your waking life, perhaps you feel that things are going your way and everything is, and so there's this model that what you dream about is a reflection, whether it's emotional reflection or whether it's just things that are going on in your day, but a reflection certainly of your waking life. Another very common dream is that you come to a place that you either show up in school or you show up at work and you're not fully dressed, right? Or you're underdressed. So like you're in your pajamas, or you're just wearing a tie or whatever, And so one of the things that, because of the physical overexposure in your dream, the way that you came to work without a shirt or within your pajamas, because you've overexposed yourself, that's a reflection of perhaps you felt like in your waking life, maybe you told somebody something too personal. Right? You overexposed yourself. And so the reflection of that emotion would show itself in a dream in this particular storyline. But it's interesting that we do tend to dream about the same things. In fact, when we mention these dreams, people, when I've spoken about this in many different places, everybody in the audience has had almost all of these dreams, right? If at least one. And so it's a very common theme that our brain processes our emotions, our daily activities, and translates it into this sort of story. Now, so what is this? What is this story from a spiritual perspective? What's a Jewish perspective on dreams? So when it comes to dreams, there are a few different types. I'm going to give you the short answer and then kind of elaborate on it as we continue. The short answer is that there's several types of dreams. There are dreams, certainly in our biblical tradition, that carry with them a prophetic value. We see that all across the book of Genesis, where dreams are clear foretelling of the future. Then we have dreams that are emotional processing of that which went into our day, like these examples that we were just talking about. And then there is the dreams that are completely meaningless and are just either rehashing, processing the bits of information that we left unprocessed during the day. We think of all of the events and things that we encounter throughout our day, all the people that we've seen, all the stimuli that have come our way. Our brain takes note of that and processes that and puts that into a dream. It doesn't necessarily have any meaning, but it will reflect again in the dream world. And so the sages teach that it's one of two things. Either the dream is prophetic, right? It has spiritual value. It can tell the future, which is these days, especially 0.0000001% of dreams. And the vast majority of dreams are a rehashing of something that happened in your day, right? Either personally, and you're processing your emotions, or it's something that occurred to you in your day, something you were thinking about, something you saw in your day. And Rabbi Nachman of Breslov actually gives an interesting way to remember it. He says that the word Michael, food, and Malach, angel, have the same letters. So the idea is that that your dreams that you have are either a result of the food you ate, meaning your daily experiences, or the result from the heavens. So let's talk a little bit about the prophetic, the spiritual, valuable dreams as they're seen in Jewish tradition. So some of the interesting things that we learn, and we're right in the middle of these Torah portions right now as we speak, is we find 10 instances in the Torah, in the book of Genesis, that dreams carry with them prophetic meaning. 10 instances, 10 times. All of them take place in the book of Genesis, and all of them are read this time of year. One of the interesting things that we find is that the root word for dream, ches lamed mem, is found 48 times in the book of Genesis, and then 7 times in the other books of the Torah, the other 4 books of the written Torah. And that's interesting because there are 48 prophets, male prophets listed in the Gemara and the Talmud, and 7 prophetesses, 7 female prophets that are recorded as well. So the idea is that it's almost like a hinted indication that our dreams can carry with them some sort of spiritual or prophetic meaning, potentially. Again, this is in biblical times when people were much more spiritual, much less engaged in the world, and inherently much more righteous people. One of the things that's interesting, by the way, is that when the dreams come up in Jewish tradition, in the biblical text, the time that they're read is this time of year, is in the month of Kislev, always, right? Because we start Simchas Torah, and they're always read this time of year, the time of year where the night is the longest, meaning the dreams, right? It's the time most appropriate for dreaming. So as far as the Talmud, as far as the dreams are concerned in Talmudic tradition, there is the idea that in the end of the volume of Brachos, which talks about blessings essentially, but the end of the tractate, the end of the volume, there are pages and pages dedicated to the meanings of dreams. If you dream of a camel, it means this. Not that our dreams today are on that same sort of caliber, but such a thing was something that was believed in and was appreciated and studied. Dreams in general are said to follow their interpretation. In other words, whatever a person dreams about, if it is prophetic in nature, it doesn't come into physical fruition in this world until it's interpreted, right? It's kind of neutral until it's interpreted. If it's interpreted for good, it comes out as good. And if it's interpreted in a negative way, it comes out as negative. The wording in the Talmud is that dreams follow the mouth. And what's interesting is that the word dream in Hebrew is chalom, right? Which has the numeric value of 84, and peh, mouth, has the numeric value of 85. So the dream is followed by the mouth. In other words, when the dream happens, in order for it to sort of manifest, if it is prophetic in value, has to come about through the way that it's interpreted. So dreams were so real in the ancient times, not only biblical times, but also Talmudic times, in the times of the early sages, and even in the times of the later sages, in the earlier parts of the later sages. Dreams carried with them tremendous value. They were considered a vehicle, a mechanism for spiritual communication. Something that we find is that if a person had a bad dream, that they were according to Jewish law, allowed to fast. They were allowed to fast in order to sort of repent that the bad dream shouldn't come into fruition. And what's interesting is that halachically, according to Jewish law, that person was allowed to fast even on Shabbat, even on the Sabbath, when you're required to have 3 meals. And so you see that the strength, the validity that was given to dreams, in the sense that in order to annul any sort of any negative effects of the dream, you're allowed to fast on Shabbat. That shows the tremendous weight that dreams played in our tradition. There were methods in the old Siddurim, in the old prayer books, that were sort of like we do before Rosh Hashanah, Hataras Nedarim, of annulling vows. There was a whole procedure of annulling a bad dream, that if you had a bad dream, you would not tell the details, but you would say it to a few of your friends, and they would sort of say it's okay, it's not, none of the bad stuff is going to come about from it, and it would annul the dream. There's another way in our tradition that is seen to annul bad dreams, and that is through Birchas Koyanim, in the priestly blessing, which outside of the land of Israel we only say on the holidays, on all of the Yom Tovim. And what's interesting is that when the priests, when the Kohanim are up giving the prayer, giving the blessing to the Jewish people, one of the things, if you open up the siddur, you open up the prayer book, there's a paragraph that the congregation reads as they're blessing the people, and the reading is this asking of that any dream that I've dreamed should be annulled, right? If I had a bad dream, it should be annulled. And you think to yourself, what an odd time to ask for dreams to be annulled, like during the Birchas Kohanim, during the priestly blessing. And so there's an interesting thought that's brought out. So the Noam Elimelech, one of the Hasidic masters, teaches that one of the reasons that is found there, particularly at that time, is because when the Kohanim, when the priests are blessing the Jewish people, they achieve a level, spiritually speaking, that's almost like prophecy. It's akin to prophecy. And one of the premises that we have in our tradition is that when you have something that's a ratio of 1 to 60 to 1, that there's nullification, right? So if you have a big pot of meat and a small drop of milk falls into the pot, don't try this at home, but officially, if there is 60 times the amount of meat in the stew, and there isn't a little drop of milk, that little drop of milk is nullified, because as long as 60 to 1 is like the magic number. So our tradition teaches that a dream is 1/60th of prophecy. And so since the Kohanim, since the priests are at a state where they're akin to prophecy, any bad dream that you have experienced is annulled at that particular moment, because it's 1/60th right there. So there were also great sages in Talmudic times, and also in the times of the early sages, the Rishonim, that were very spiritually uplifted, very, very holy people, and they were able to facilitate a dream communication. In fact, they would have what's called a Shilas Chalom, a dream question, where they would prepare themselves in a certain ritual way. Again, this is for extraordinarily pious people. They would fast, and they would mikvah. There's the whole ritual to precede it. And they would ask questions that were disturbing them in their studies, things that they couldn't get an answer to. Not what's the winning lottery numbers. They'd ask, like, which tefillin is better? Right? Which tefillin is the correct way? Rashi or Rabbeinu Tam's way? And so there's a very famous book that is published. You can still buy it in your local Judaica store. They carry a lot of books. Is by Rabbi Yaakov of Marvich, who has a book that's called Chuvas Min Hashamayim, Responses from Heaven, where he records over 70 of his responses that he received in the dream state. Again, so this is something that was this was much more relevant in earlier generations. So one of the reasons why it was more relevant in earlier generations was because one of the premises of our faith is that there's Yeridas Hadoros, that every generation has a spiritual devolution. Just the nature of being one generation farther removed from Adam, the first human being, or from the giving of the Torah, that pivotal event, each generation down the line is less spiritually attuned or more calloused. That's just the nature of how it works. So spiritually speaking, compared to the earlier generations, for sure the biblical generations, We are so calloused. We are so insensitive, spiritually speaking, that the idea of having a prophetic dream, or a dream that we're able to clearly convey something that was going on in the spiritual world, becomes much more unlikely. It's not impossible, but it becomes much more unlikely. But another key reason, which really brings us to what we're talking about today, another key reason why we can't trust that the spiritual nature of our dreams today is because we're so bombarded with external information during our waking life that it would be almost impossible to determine whether what you're experiencing in the dream state is something of prophetic value, or whether it's just something that you are processing that you don't even realize that you processed. There are a lot of things, because of the internet, that play a role and show themselves in our dream state. We're not even aware. So you might be scrolling through Instagram, and you see a picture of someone that you hadn't seen a picture of in a long time, but not even registered consciously that you saw the picture of them, right? They just kind of came in your feed and you didn't even think twice about it. And then you have a dream about them. And then you say, oh my gosh, I haven't thought about that person in 20 years. Where'd that come from? Well, it came from your Instagram, right? But you weren't even aware that was the case. And there's so much stimuli from many places, but the internet in particular, that can cause us to dream in a different way, or at least to have a more calloused perception of what the dreams are conveying. So I think my two colleagues who spoke earlier spoke very, very interestingly about the effects that dreams have, certainly in that the internet has on a person in their waking life, and their ability to process their emotions. So when that is then transferred into the dream world, it's going to, by default, by nature, it's going to have an effect on how spiritually attuned a person is going to be able to be. Now, it's known that media in general, or our accessibility to media, has changed inherently the way that people dream. So there was a study that was done, I believe, in Scotland about 10 years ago. And what they found was that people who were above the age of 55, I think the number was 55, people who were above the age of 55 dreamt much more in black and white than their younger counterparts. And you ask yourself, well, why? So the ones that were slightly younger, who grew up also with Technicolor, and when they were children, Technicolor televisions came out, they dreamt more in color. But since these young people, when these people who are now over 55, when they were growing up, they saw, whenever they watched television, it was only in black and white. Whenever they saw a photograph, it was only in black and white. And they tended to dream in black and white more than their younger counterparts. Because again, as my colleagues spoke very, very interestingly about the effect that it has in our waking life. If in your younger years in particular, if this is what you're sort of subject to, and this is the way you process the world, this is the way that it's going to reflect in your dream world as well. And so think about if a dream is, let's say, not even of spiritual prophetic character, but it's an expression of emotion. Well, we just got finished learning the emotional effects that social media and internet have during your waking life. So of course that's going to show itself in your dream world as well. You're going to be processing emotions in a different sort of way. You're going to be all over the place, right? It certainly does affect the way in which we dream. There's just no question about it. The caliber, absolutely, and the nature it would make sense that would be in that way too. Just want to close on something that we can all kind of walk away with when it comes to the idea of sleep, dreams. There was a question that was asked to the Lubavitcher Rebbe: why did God create the human being as a creature that needs to sleep? Spend so much time, like why just let us go without take some coffee and just continue on forever? So why did God create us as a creature that needed this thing called sleep? So Rabbi explained something very interesting. These are my words paraphrasing. You ever have a day in your life where you just, for one reason or another, you just wished it was over? Something happened, right? It feels like it's one of those days, right? Either you had a moral failing or just one thing after the other and you just, when it's the end of the day comes, you're like, I cannot wait for this day to be over. What would happen?
Never end.
Exactly. What would happen if you didn't sleep? What would happen if you didn't have if it wasn't built into your system to sleep?
That's the ultimate nightmare.
Right? That's right.
Very good.
The idea is that the idea of sleeping was God telling you that there's a concept called tomorrow, right? That you can start fresh, not only physically refreshed, but emotionally and spiritually replenished, and you can start a new day. So there are certainly gifts in sleep that we can still process today, even if we can't reach the caliber that we could once do in the dream world. And happy Hanukkah.
Wow, fascinating, Rabbi. I love, of course, what the Rebbe had to say about it. That's just beautiful. But in some kinds of psychotherapy involve a lot of dream work, Freudian, of course, Jungian, and so forth. And from just my own experience with such things, it is very, very, very hard for us to remember and to take seriously our dreams. And this was not yesterday, this is a while ago yet, but there is something. There are dreams that seem to come naturally and you know them, but most dreams, if you care to know what them, it takes tremendous effort. Any comment on that? Why is it so hard for us? Is it the same thing you're saying?
To like remember dreams, or
to remember to take them seriously?
Well, I would say that most of the dreams that we have today
don't deserve to be
don't deserve to be taken seriously.
Fair enough.
If a person has a sort of recurring dream
Mhm.
that or centers around a certain theme or a certain person, it may be worthwhile to think about in your waking life, what this might be all about. Some of the dreams that we mentioned earlier in the discussion might be telling of something that you weren't aware of consciously, but that your subconscious picked up on, or emotions that you're feeling or that you're repressing in your waking life. And that might be something to say, hey, you know what? Why am I feeling this way? Or what's causing this? And it might be able to allow you to make amends in your waking life as well.
Rabbi Steinberg.
Yeah, thank you, both of you, for really an excellent presentation, each in his field. Just a few scattered comments. I mean, that is a vast field. I'll start with some things that you said in your excellent presentation. One point is that there is a big dispute amongst the Rishonim how to view the relationship between prophecy and dream. According to some of the Rishonim, Rambam and others, it is a continuum. It's only a quantitative difference. A dream is 1 in 60 of a prophecy, and a real prophecy is close to 100, except for Moshe Rabbeinu that was a full 100. But even the prophets had some parts in their dream which were useless, that they were just part of the dream, but not of the reality. But the greater percentage was true, was a prophecy. Whereas other Rishonim say that there is a qualitative difference between dreams and prophecy. Dreams have nothing to do with prophecy. It's just coming up from your daily experience, from what you ate and from what you thought about, has nothing to do with prophecy. Whereas prophecy has nothing to do with the daily experience. It's all coming from heaven, and this is what you are told. The Ramban has the Abarbanel has a big, like his ways with the 20 questions, and you lose the track where he starts to answer and what, but he really goes against this assumption that there's something true in a dream that is not coming from a prophet. So these are very fundamental differences. That it comes also from the Gemara itself. There is a verse in Tanakh that says, Chalomot hashav yedaberu. Dreams speak falsely. Now, you can read it in two ways. You can read it as a statement, Chalomot shav yedaberu, dreams talk falsely, or you can say it as a question mark. Chalomot hashav yedaberu, do really dreams talk falsely? And the answer is no, they don't talk falsely. There are positive things in it. And the balance between these two opinions is a very interesting halachic balance. According to halacha, if someone dreams that there is a great amount of money buried under a certain tree, and no one knew before the dream that there is such a thing, that there is money there buried. So it was revealed through the dream. But the dream also says that this money belongs to someone else. So if you go after you wake up and you dug out the money, it belongs to you. You don't have to give it to the other person, because the dream is not fully a prophecy. So as long as something was fulfilled, it doesn't mean necessarily that the other part is true as well. That's a halachic consequence. The same as another example is if you dream about, always you dream about money, because people talk about money during the wake time. And you dream that there is money buried somewhere that no one knew up to this point, but there are meiser, and you have to give it to a Kohen or to a Levi. Although it has a kedusha, it's not only belonging to someone else, it comes with a kedusha in it. It's meiser, it's truma, that usually if you're not entitled to use it, you're not allowed to use it. Yet if you found it, it is yours and you can use it. So that is sort of a balance between what is true in a dream and what is false in a dream, but it's not clear. There are so many contradictory examples that it is hard to formulate, I think, something that goes along all the time. The same as you mentioned, the response of Min Hashamayim, which is amazing. Rabbi Yaakov dreamt a question, a halachic question. He gets an answer in his dream, and the question is it the right answer? Do you follow it? And most poskim say, no, you don't follow it. And all the responsa that he wrote is by most poskim unacceptable halachically, despite the fact that he records a dream with a solution on a halachic matter. Just as an anecdote, and I think it's an amazing thing, I went to ask a question of Rabbi Wosner, who was one of the greatest poskim in recent years. He wrote Responsa Shevet HaLevi, and a very important posik in the neighborhood. And he was a student in Chachmei Lublin that Meir Shapira established in Galicia, which in Galicia wasn't common. Yeshivas weren't common. Yeshivas come from Lithuania. In Galicia, a father taught his children. There was no such thing that you send your children and you rely on a Rebbe that will teach him. Why shouldn't you teach him? You are responsible, you are the father, teach him. And that was the concept. And Meir Shapira introduced into Galicia a yeshiva, Chachmei Lublin. And he was one of the first students of Wosner. my great-grandfather was a posek in Galicia, and he was opposed to yeshivas. He didn't really think it's the right thing. He thought it's his responsibility, and he should teach. I came to him to ask a question, and he said, before you ask the question, I must tell you, I had a dream the night before I came. I never met your great-grandfather, but I know his book. His book was called Responsa Machze Avraham. And I knew it very well. It was a very important source. And I dreamt, during the day, I had a shaila that I couldn't resolve. I couldn't find an answer. When I fell asleep, your great-grandfather came in my dream and told me the answer. And I didn't think about the answer. And now that I got up, I looked it up, and he was right. I never met him, and here you are coming to me the following day. Amazing. So I don't know what to make with such dreams. That's what I told him.
None of us do.
So actually, dreams are very complex. From a scientific point of view, they are even more complicated. I mean, the 19th century, the beginning of the 20th century, dreams were very important tools for psychoanalysts to treat people. I think by now, maybe you can correct me, but by now it's not that well founded anymore, and I think very few people use the dream method and the dream resolution as a form of therapy. I think it lost its charm. And science today thinks that it is really a clearinghouse. You are so much involved during the day with so many things. It's a processing and getting rid of some things that you really don't need anymore. So because you are dopaminergic or other influences of your brain are tremendous during the day. Some you understand, some you don't understand, some you realize, some you don't. You need to clear your mind. So this is a reason to sleep and clear your mind from some of the daily experiences which are useless. You don't need them, but they occupy part of your brain. That's a theory. I don't know if it's true. Maybe tomorrow someone else will say something else. And one comment to you, obviously I certainly agree that the dangers to the developing brain is tremendous of the new media. That is something that I think there's no argument. I try to say only one thing, that technology of this kind will not disappear. It is not because we think something is wrong with it, so let's get rid of it. And then we'll gain the good without having any bad. This, I don't think will happen. And therefore, we have to use it correctly, and in my view, educate to use it correctly. And I think the education part is what is missing today. It is free for all. Everyone thinks maybe it's good, maybe it's not good, but it's free and do it. And no one really educates that there are good parts in it and there are bad parts of it. There are times that you should use it, there are times that you shouldn't use it. There are age limits to what you can use. And I think this is where we should go in order to control it. Not in a way that we say everything is wrong, it can cause so much damage, let's close up our eyes and don't look at it. For children is one thing, for adults is another thing, and I certainly agree with what you said. I don't think, I didn't mean to say something else.
I understand.
No, I just want to clarify.
I want to respond, and then I'd like to comment about something that you said. So first of all, I definitely hear you that you don't want to throw the baby out with the bathwater. It's the saying in English. At the same time, I think we can't ignore that these social media platforms create algorithms that are specifically designed to induce addiction. And that whether we educate or not, we're still exposing certainly our children or adolescents to things that are highly addictive and they're just not equipped to deal with it. But I'll tell you that I worked with quite a number of adults who are very addicted, that create a lot of stress in the marriage and the family, and it's a terrible role model, terrible thing for kids. And that, yes, education can help, but I think that in terms of specific social media that is so highly toxic, I think we have to question whether or not it really makes sense. And there is a tremendous movement now to eliminate social media in people's lives, or there are documentaries of people who became social media free and how liberating it was, and how it enhanced their lives, and how much time they had available for things that are really constructive and productive and creative. That's not addictive. That can enhance yourself. So firstly, your presentation was highly engaging, and I enjoyed it thoroughly.
Thanks so much.
I just two comments. First of all, in terms of, I was fascinated by the study you said about the thematic patterns cross-culturally of the dreams. So it reminds me back in college in the 70s of Jung's collective unconscious. That we have a collective unconscious that transcends all cultures and demographics, and I think it's because we are part of the same bria, we're part of the same creation. Sure. This is something that's at a much higher spiritual level that that binds us, as people, as Jews. So I thought that was fascinating. The other thing I want to mention, you mentioned about remembering and forgetting dreams. So there's a little known fact that rapid eye movement, REM, is very instrumental in terms of the extent to which we remember our dreams or forget our dreams. So there have been a number of studies. There's a world-renowned, you probably aware of, neurobiologist who is the world expert in the neurobiology of trauma, Bessel van der Kolk. He's a Dutch neuropsychiatrist who discovered that there are chemicals that are released during rapid eye movement that actually travel to the hippocampus, and they disrupt the neural connection between the hippocampus, which is the memory center of the brain, and the dream and the trauma, or the memory of the dream, and it actually degrades the memory trace. And that's why we don't remember. We know we had a dream, but we can't get it. That's because of REM. The rapid eye movement actually degrades the memory trace, and that's part of the processing, because we want to let go of this stuff. Otherwise, if we just kept accumulating, we would all be unhealthy. We'd be like quasi-psychotic.
But at least I believe, sometimes there are dreams that are significant and meaningful.
Yes.
So how do we save those while we get rid of all the?
So I don't have the answer to that question, but I will tell you that we don't understand a lot about dreams. That's for sure. But we do know. I believe that Hashem has created our nervous system in such a way that allows to filter our dreams so that we aren't overloaded, and that we can. But some of those dreams are being processed at an unconscious level outside of our conscious awareness, and the reason why for the degradation of the memory trace is so that it doesn't keep accumulating, and our nervous system doesn't get overloaded.
So it's automatic pilot, so to say. The dream itself is working out
at
issues.
an unconscious level, exactly. And the last thing I wanted to say is that when we do have this rapid eye movement that comes always during dream activity, in trauma victims, we know the research is very clear that it affects the processing of dreams, and that's why we have people who are traumatized have these recurring dreams that they can't get rid of, like with Holocaust survivors. 50 years after the trauma, their dreams are still in the camps. They're running from the Nazis because the traumatized brain has been damaged in its ability to process our dreams. So one of the things that we have developed a technology called eye movement desensitization and reprocessing, EMDR, which has been around now for 25 years, that enables trauma victims to be able to process their dreams through the elucidation of the rapid eye movement, so they can actually heal from their traumas, and it's profound. It's in its impact. So I just want to share that.
Just as a comment to your memory, non-memory, as you said, the REM stage, which is after 4 non-REM stages when we fall asleep. The process of falling asleep entails 4 stages of getting deeper and deeper sleep, which is non-REM. And then all of a sudden, when you do an EEG, you see that the EEG is of an awake pattern, although you are deep asleep. And that is when REM comes in. So it's sort of a beginning of waking, but only subconsciously. And people used to think that you can't dream during the non-REM stages. You have to fall asleep deep, sort of getting waken up, at least electrophysiologically, starting with the REM movement, and then you dream. Now, in the average, it takes 90 minutes for such a cycle. 90 minutes of 4 stages of non-REM, and then the stage of REM, and then you start a new cycle of non-REM, and so on. The longer you sleep, which is usually during the morning hours, the cycles become much closer. And instead of 90 minutes per cycle, you get to 20 minutes, or sometimes even avoid altogether the non-REM, and you're only in the REM cycle. And that is why people thought that you can remember a dream only if you dreamt it before you got up. You don't remember any dream that happened in the beginning when you started to sleep, because supposedly you didn't dream, because it wasn't the REM stage at that stage. But we know now, almost for sure, as sure we can be, that there are dreams even in the non-REM stage, but you don't remember them. Now the question is, why don't you remember them? And you do remember at least that you dreamt, even if you don't remember details in the REM stage. We still don't know. I mean, the dream is a very complex scientific part. I'm not talking about the prophecy and the spiritual aspect of it and the purpose of it, but just as a fact. But I must say, from a personal experience, sometimes I fall asleep during the day. I'm tired, I fall asleep. I don't sleep 90 minutes. I sleep 10 minutes, 15 minutes. Certainly, I didn't test myself, but I didn't get to the REM stage. And yet I remember that I had a dream.
Yes.
So it means that you do dream even in the non-REM stage, just it takes too long for you to remember that you dreamt. I think that's a scientific proof from a personal experience.
So I'd like to ask you a question. How do you differentiate normal REM dream activity with hypnagogic and hypnopompic activity when we fall asleep and right before we wake up?
Right.
Do you see that as quasi-dream activity, or?
I think so. I mean, it depends what is released, what chemicals are released in the different stages. Why do you get the different stages? And that by itself is not clear at this point. So we really still are far away from understanding, and that's what I said, that scientists think that they can get to the Mars and they can get to the moon, so they know everything. But they don't even know what happens during every night that everyone sleeps.
Yeah, it is mysterious, something, and that's why I think it's associated with spirituality and prophecy. Dreaming is mysterious, even to a scientist. And I'm very glad we had you talking about dreaming, because that tied together a lot of the things that we've been discussing. And I just thank you, gentlemen. I think it was a marvelous panel. I was rapt attention throughout, and I'm sleepy now, so that's pretty good work. So I thank you all for being with us. I hope you enjoyed this panel a fraction as much as I did. I benefited greatly from it. And I'm not as depressed as I thought I'd be now, because we got the dreams. So we will take a break on Shabbos, and we will be back Motzi Shabbos, or Saturday night, as we say. And we're going to go in the opposite direction a bit. We're going to look at positive uses of social media, and perhaps a way to tame the beast, as it were, as a way to make it into something that we can, what shall I say, embrace, and somehow take some of these fearful elements out of it. I don't know if it can be done, but it could be directed as well, we're going to hear on Saturday night, towards goals that I think we all agree are of benefit and value to humanity, as the situation we have now, where I think, despite, I love getting to my high school friends, I love learning, I love speaking all over the world without having to get on a plane. That's all wonderful, but I'm more fearful of it than happy about it. Hopefully, maybe after Saturday night's program, we can be a little less fearful and more optimistic. Gentlemen, thank you. Thank you. We'll see you Saturday night.